Hello, and welcome to the Congressional Hispanic Caucus Institute's 2021 Capitol Hill Briefing Series. I'm Marco Davis, President and CEO of CHCI. This series is the culmination of CHCI's premier 9-month graduate fellowship program, which offers exceptional Latinos unparalleled exposure to hands-on experience in public policy. This unique fellowship program seeks to enhance participants' leadership abilities, strengthen professional skills, and increase the presence of Latinos in public policy areas, specifically in the areas of health, technology, housing, child welfare, and education. CHCI is thrilled to be able to offer our graduate fellows the opportunity to share their perspectives on policy issues they're passionate about and convene leaders in this work for an informative conversation. We would like to thank our Graduate Fellowship Program sponsors for supporting the program, including Facebook, the PepsiCo Foundation, Casey Family Programs, the Walton Family Foundation, Bristol Myers Squibb, DaVita, Wells Fargo, CVS Health, Fresenius Medical Care, and Bank of America. You can keep today's conversation going by using the hashtag CHCIFellows on social media. Please visit chci.org to learn more about our graduate fellowship program, as well as our other leadership programs and special events. And we encourage you to reach out to our fellows via LinkedIn to find out more about their policy topic and help them connect with job opportunities for when their program concludes in May. Enjoy the discussion.
Thank you, Marco. All right. Well, everyone, please help me in welcoming Congressman Richard Neal, representing Massachusetts' 1st Congressional District and Chairman of the House Ways and Means Committee.
Welcome and thank you for attending the Capitol Hill Briefing Series, Food Insecurity in Older Adults, COVID-19 and Beyond, moderated by Fabian, Lucero, and hosted by the Congressional Hispanic Caucus Institute. I'm Congressman Richard Neal, and have the honor of representing Massachusetts in the 1st Congressional District, and simultaneously chairing the House Ways and Means Committee. Ways and Means is the chief tax writing body in the House of Representatives and the oldest committee in Congress, first established in 1789 with our Constitution. Food insecurity for older Americans has been a rapidly growing crisis since the early 2000s. It was made worse by the Great Recession and has dramatically increased again with the onset of coronavirus disease and the pandemic. Increasing food security is shown to reduce medical costs and improve the quality of life for Medicare beneficiaries. Like many issues in America, deep inequities exist. We know that food insecurity is made worse for people of color, those with fixed budgets, and individuals living with disabilities. Medicare beneficiaries deserve to live and have a quality of life that includes being able to afford medication and healthy meals without having to choose one or the other. The Ways and Means Committee believes it is our duty to contribute to a more perfect union for all Americans, including those overlooked and indeed left out. The committee staff report, Something Must Change, Inequities in U.S. Policy and Society, reflects on existing health and economic injustices and highlights the impact of COVID-19. Food insecurity is yet another one of those cross-sector issues calling for a cross-sector solution. The COVID-19 pandemic is hardly over, and lessons from the past show us that we will be feeling the health and economic ramifications well after this crisis is behind us. That is why I applaud the enactment of the American Rescue Plan as Congress took a seismic step toward finally trying to get ahead of the virus in a package that will be remembered by the lives that were saved and by how we set up our economy to recover more equitably and justly than ever before. I'm immensely proud of the aggressive course of action that the Ways and Means Committee contributed to this package, and from my fellow members of Congress for the excellent committee staff work that they did. Fabian is a health attorney and a Congressional Hispanic Caucus Institute Policy Fellow placed on the House Ways and Means Committee on Health. Fabian has gained a passion for health law and policy while studying public health and working night shifts as a patient care technician in the intensive care unit at Tucson Medical Center. He was able to connect the health inequities he was learning about to what he saw firsthand in the ICU and decided to go from helping one patient at a time to helping many communities of people through legislation. I want to thank all of you for participating in this conversation today to help raise concern and develop solutions to tackle food insecurity for older Americans. And thank you.
Thank you, Chairman Neal. My name is Fabian Lucero, and let's jump right in. In 2018, 37 million Americans were food insecure, and the ongoing COVID-19 pandemic is expected to increase that number to 52 million Americans. As COVID-19 rages on, more than 8 million Americans have fallen into poverty since May of 2020, disproportionately affecting Black and Latino communities. The United Nations has warned of a looming food crisis as COVID-19 threatens the worldwide food supply chain, creating a real danger that more people may actually die from the economic impact of the virus than the virus itself. In the US, the rate of hunger among seniors aged 60 and older has increased by 38% since 2001. Currently in the United States, household hunger has tripled 2019 levels. Medicare beneficiaries over the age of 65 are particularly at risk for food insecurity due to fixed budgets, the cost of medical care, and transportation and mobility issues while requiring nutritious food to maintain a healthy lifestyle and mitigate chronic disease. In 2018, 60 million Americans were enrolled in the Medicare program, with 86% of beneficiaries being over the age of 65. Some of the most prevalent chronic diseases Medicare beneficiaries face are diet-related, such as high blood pressure, high cholesterol, diabetes, heart disease, and heart failure. 80% of older adults live with at least one chronic health condition, while 77% have more than one. As a whole, 1 in 10 elderly Medicare enrollees are food insecure. When breaking down for race and ethnicity, 1 in 4 older Black and Latino beneficiaries are food insecure. Food insecurity is defined as a lack of consistent access to enough food for an active and healthy life. Across the nation, nearly 8% of white households are food insecure, compared to 19.1% of Black households and 15.6% of Latino households. Food deserts exemplify how the social determinants of health impact food insecurity. Food deserts are areas where it is difficult to buy affordable or good quality fresh food. 19 million Americans live in a food desert. In an urban area, this means living more than a mile away from a supermarket, and in a rural area, more than 10 miles. Even if there is access to fresh produce in low-income neighborhoods, food is more expensive, especially in convenience stores where there is limited variety and poorer quality produce. Less than 50% of seniors eligible for SNAP benefits are actually enrolled in the program to help with hunger and food insecurity. This is because of participation barriers like lack of awareness, difficulty applying and staying enrolled, stigma, and language barriers. Access to SNAP is associated with increased financial security and reduced healthcare costs in Medicare and Medicaid, as lower income adults are less likely to skip meals and are less likely to implement dangerous cost-saving measures like stretching out prescription medications. One study showed that after a year of receiving SNAP, elderly adults were 23% less likely to enter a nursing home and 4% less likely to be hospitalized. Medicare beneficiaries are most likely to be food insecure when faced with chronic comorbidities and mental health conditions like severe depression and anxiety. Physical and mental health disabilities are associated with increased economic hardship and difficulty performing activities of daily living, such as cooking. Food insecurity has a negative impact on overall health and economic stability. Food insecure patients spend nearly $2,000 more on annual healthcare expenses and are 47% more likely to be admitted to a hospital due to food budget exhaustion compared to their food secure peers. Examples from the 2008 recession show that food insecurity will not disappear once the economy recovers from the COVID-19 pandemic, where after the recession, it took nearly a decade for food insecurity to drop to the same levels as before the recession. And with that, I would now like to introduce our panel. Dr. Munoz is a registered dietitian and the Assistant Chief of Food and Nutrition Services at the VA Healthcare System of Southern Nevada. And like Chairman Neal, she is a lecturer at the University of Massachusetts, Amherst. At the VA Healthcare System in Las Vegas, Dr. Munoz helps oversee the care of over 65,000 military veterans. Originally from Puerto Rico, Dr. Munoz holds a doctorate in nutrition from Rutgers University, a master's in healthcare administration from the University of Maryland, and a Bachelor of Science in Food and Nutrition from Marymount College in New York. Her areas of expertise include nutrition and pressure injuries, malnutrition, and nutrition and the older adult. Nancy is the chair-elect of the Healthy Aging Dietetics Practice Group and a member of the Academy of Nutrition and Dietetics. Please welcome Dr. Nancy Munoz.
Good morning, everyone. It's my privilege to be here today to share information about the role of nutrition in promoting health and well-being. And Fabian, thank you so much for that kind introduction. Next slide, please. Over the past 10 years, the population aged 65 and older has increased from almost 39 million in 2008 to 52 million in 2018. This reflects a 35% increase in older adults. The older adult is the fastest growing segment of the U.S. population, and it is expected to reach approximately 95 million people by 2060. Next slide. Healthy aging and health and well-being doesn't just happen. We really need to start early in life. In order to avoid the physical and mental deteriorations that are associated with aging, we must eat a nutritious diet, maintain a healthy body weight, and be physically active. Sounds pretty simple, doesn't it? There's no magic bullet, no magic formula. It's really truly is that simple. Next slide. Nutrition is a major determinant of health status. Food, as a major source of nutrition, is not only critical to one's physiological well-being, but also contributes to social, cultural, and psychological quality of life. Primarily, nutrition helps to promote health and functionality, but it's an effective disease management approach that can really lessen chronic disease risk, slow disease progression, and reduce disease symptoms. Next slide. About half of all American adults in this country have one or more preventable chronic disease, many of which are related to poor quality eating patterns and physical inactivity. You know, the old adage, we are what we eat, it's really truly alive and well. Food is chemistry. Food helps us nourish our bodies. In 2016, 38% of people aged 65 and older had one chronic condition. 47% had 2 to 3 chronic conditions, and 15% had 4 more chronic conditions. And again, a lot of these conditions can be controlled or mitigated by the use of consuming adequate nutrition. Some chronic diseases that are commonly seen in older adults include hypertension, arthritis, heart disease, physician-diagnosed diabetes, and I qualify that because there's a lot of people with diabetes and they don't even know they have it, cancer, and stroke. With something as simple as following a healthy diet, we can prevent, delay the offset, or control the symptoms of many chronic conditions like the ones that I just mentioned. Next slide. Obesity is a major cause of preventable disease and premature death in our population. It is associated with increased risk for coronary heart disease, type 2 diabetes, and many types of cancer and disability. During 2015 to 2018, about 40% of older adults aged 65 and older had obesity, and this is an increase from 30% in the time period of 2003 to 2006. To prevent obesity, again, we must ensure that older adults have access to wholesome foods. And it's just not just the access to the wholesome foods, but in the right amounts. Next slide. A study from 2014 tells us that households with an older adult often must choose between paying for food or paying for other items on a daily basis. As you can see on this slide, the highest percentage of respondents have to postpone getting care or medications in order to be able to pay for utilities, put a roof over their head, or even secure transportation. Next slide. The patients that walk through the door of our healthcare facilities and institutions are very often malnourished. Protein-calorie malnutrition is the most common type of malnutrition amongst hospital inpatient stays. In 2013, 7% of hospital stays involved some sort of malnutrition. Out of those malnutrition-related stays, 64% were categorized as protein-calorie malnutrition. Weight loss or failure to thrive was the next most common type of malnutrition at 22%. And malnutrition in our hospitalized patients increased length of stay of that event, increases healthcare costs, impacts clinical outcomes. Many of these patients, once they get back to their previous setting, they're never the same. They're really, truly more compromised than when they enter the hospital. And we often penalize the hospital for the patients under their care that develop malnutrition, but in many instances, malnutrition has been developing during a lifetime of deprivation for some of these patients. So it's really hard to get from behind the eighth ball. Next slide. Poor health can be both a cause and a consequence of food insecurity. Older adults who are food insecure have low intake of calories and key nutrients such as protein, vitamins A, C, B6, and thiamine. Major minerals like iron. In older adults with decreased protein intake, we see loss of muscle strength. In those that develop sarcopenia, we often see that there's impaired nutritional status, disabilities, and loss of independence. We also see increased risk for falls, fractures, and infections. Again, all of which will make it very difficult for these patients to fully recover. Poor nutrient intake can leave an older adult at risk for being more susceptible to sickness and have a reduced ability to get back to their baseline, continue to fight illness and infections. It can also contribute to unintended weight loss, and most importantly, it really increases mortality in our population. Thank you.
Our next panelist is Linda Flowers. Linda is a registered nurse and attorney. She is a senior policy advisor at the AARP Public Policy Institute. Her work at AARP focuses on dually eligible Medicare and Medicaid beneficiaries, public health, health prevention, and health disparities. Before joining AARP, Linda held senior policy positions with the National Academy for State Health Policy and DC Medicaid. While at DC Medicaid, she developed the city's first home and community-based waiver for older adults and was the lead policy person on the Children's Health Insurance Program. Ms. Flowers holds a Bachelor of Science in Nursing from the University of Wisconsin, a Master of Science in Nursing from Georgetown University, and her Juris Doctor from Golden Gate University. Please welcome Linda Flowers.
Thank you so much, Fabian, and thank you so much for putting this briefing together. It's very timely. And I just also want to thank two of my colleagues, Olivia Dean and Nicole Berta, for helping me put this presentation together. Next slide, please. So what I'm going to talk about today, really briefly, because others have really gone into this, is the definition of food insecurity and the health implications for older adults. Strategies that older adults use to cope with food insecurity, the impact of food insecurity on the healthcare system, racial and ethnic disparities in food security, and then causes of disparities and possible solutions. Next slide, please. So the official definition of food insecurity as the USDA defines it is limited or uncertain availability of nutritionally adequate and safe foods, or limited or uncertain ability to acquire foods in socially acceptable ways. Next slide, please. So translation means, I'm going to translate that wonky definition into something I think we can all relate to. So really, it's about lack of consistent access to healthy foods due to insufficient resources, and that people who are food insecure often skip meals and don't eat balanced diets. They cut their food portions to stretch their food, and they sometimes go hungry just because they can't afford sufficient amounts of food. Next slide, please. So conditions associated with food insecurity among older adults include asthma, congestive heart failure, diabetes, hypertension, compromised cognition, obesity, and osteoporosis. And I think it's really important to focus in on a couple of these, the heart failure, the diabetes, and the hypertension, because they are associated with poor outcomes due to COVID-19. So it's really important that people have adequate nutrition, especially during public health emergencies. Next slide, please. So the impact of food insecurity on older adults' ability to fight food. Essentially, not having sufficient calories and balanced nutrition can weaken one's immune system, which in turn compromises their ability to fight illness. And so with people being food insecure coming into a pandemic, one can only imagine how that's going to compound the effect of the negative outcomes on their health. Next slide, please. So older adults have coping mechanisms that they use when they are food insecure, and these mechanisms also compromise their health. So they skip meals or eat poorly, cheaper foods, processed foods. They go without health-related diets, like they're supposed to be on a diabetic diet or a low cholesterol diet. They may not be able to afford the foods that support those special diets. They skip doses of needed medications. They stretch them out, or they wait to fill their prescriptions until they can get enough money together to fill them. And they make trade-offs between food and other necessities, as others have said. So they may go without, they may have to pay their utilities or pay their mortgage or their rent instead of purchasing food, and all of that will have a negative impact on their health. Next slide, please. It's also, food insecurity is also associated with increased healthcare costs and use. So people who are food insecure have more provider office visits. They use the ERs more often. They're prone to increased hospitalizations, and prescription drug costs are higher for increased prescription drug costs. And all of these things taken together increase overall costs of healthcare in our system. Next slide, please. So a little bit about racial and ethnic disparities in food insecurity among older adults. Next slide. So older Blacks and Hispanics experience significant health disparities in food insecurity. And this is a 2019 slide that highlights what's going on with the age 65 and older population. And you can see that it's about a little over 3 times more than the white and Asian population, the prevalence of food insecurity among Blacks and Hispanics. Next slide, please. And so disparities in food insecurity have increased during the pandemic, and that's no surprise given all of the factors that Fabian mentioned, loss of job, inability to pay their rent, having to make trade-offs, etc., compromised health. So you can see here that for all populations, food insecurity has increased, and this is these are estimates among ages 50 and older, and they have increased, but more so for Blacks and Hispanics, which is following the trend that we had coming into the pandemic. And then next slide. So promising solutions for reducing disparities in food insecurity. As Fabian also mentioned, we need to make it easier for people to get into SNAP. We know that SNAP is undersubscribed in this society, and we need to figure out why and make it easier for people who need and are eligible for these benefits to access them. We also need to increase access to healthy foods, particularly in food deserts where people have to travel great lengths to get their food, to get access to healthy foods, as opposed to going down the street and buying highly processed foods that have little nutritional value. We also need to address the underlying causes of food insecurity, including disparities, and paying attention to the systemic inequities that lead up to poverty and other conditions that are associated with food insecurity. And then we need to increase access to consistent, accurate, and reliable demographic information. And this is really important so that we can really pinpoint who is food insecure, where are the food insecure individuals living, and then to put together some sort of intervention so that they can get the access to the nutrition that they need. And next slide, please. So our AARP has a significant number of resources that we've been working on over the last few years on food insecurity. And I urge you to take a look at some of the work we've done in this area. And then finally, next slide, please. Thank you so much, and I'm happy to answer questions at the end.
Our next panelist is Erin K McGraw. Erin is an attorney and the Director of Programs for the National Council on Aging's Center for Benefits Access. Erin leads 2 nationwide programs, NCOA's Benefits Enrollment Centers, and the Senior SNAP Enrollment Initiative. These programs focus on increasing enrollment of low-income older adults and adults with disabilities into programs that help them pay for prescription drugs, medical care, food, and home and energy utilities through community-based outreach and enrollment initiatives. Erin provides training to a nationwide network of social service providers on eligibility and application guidelines for these key benefits programs. Erin also provides recommendations on proposed federal legislation and regulations, particularly on how changes will impact our most vulnerable populations. Erin graduated with honors from the College of Charleston, earned her Juris Doctor at the University of South Carolina School of Law, and her Master's in Environmental Law and Policy at Vermont Law School. Please welcome Erin K McGraw.
Thank you for having me today, Fabian. As Fabian mentioned, I am from the National Council on Aging, and our mission is to improve the lives of millions of older adults, especially those who are struggling. And our goal is to impact the health and economic security of 40 million older adults by 2030, especially women, people of color, LGBTQ, low income, and rural older adults. NCOA accomplishes our mission through direct service and a nationwide network of community partners. NCOA's Senior SNAP Enrollment Initiative is specifically designed to reduce food insecurity among older adults by increasing their participation in the Supplemental Nutrition Assistance Program. As has already been mentioned today, even before the COVID-19 pandemic began, 5.3 million seniors were food insecure. And 10 years after the Great Recession, even though overall food insecurity rates had finally reverted to pre-recession levels in 2018, seniors had still not fully recovered and were still experiencing greater food insecurity rates. And so this means that we know seniors entered the pandemic with already elevated food insecurity rates. We also know that with an economic crisis, it takes older adults longer to recover their food insecurity rate than other populations. Throughout the pandemic, NCOA has been surveying our network of community-based organizations and partners to understand the needs of older adults and their communities. Throughout the pandemic, what we've heard from these partners is that food is one of the highest needs reported continuously. We're also hearing that older adults who had not previously experienced food insecurity are now experiencing it during the pandemic. For example, We've heard from senior centers that they've had to close their congregate meal sites, and that as a result of that, older adults who used to get meals at those sites are now not receiving those regularly meals that they use to meet their food needs. Many of our partners have begun to pivot, and they are increasing meal delivery services. They're setting up food pickups. They're taking food to people's houses. Lots of unique ways that they are trying to address this need. But we know that older adults are still having issues with affording and accessing the food that they need. NCOA believes that SNAP is the nation's best program to fight food insecurity. And we also know that research shows participation in the SNAP program reduces food insecurity overall by 30%. SNAP provides older adults with a monthly benefit they can use to purchase food, and the SNAP program improves the health and well-being of those who participate. The average monthly benefit for an older adult living alone is $125 a month. And for most older adult houses, it's about 80%. They are single-person households, those utilizing SNAP. And once they're participating in the program, their SNAP participation means that they are more likely to stick to their prescription medicine use as they are supposed to, because they're less likely to be skipping pills to afford food and making those choices between purchasing their medication and purchasing food. They're also more likely to access the healthcare services they need, such as physician's visits. However, even though we know SNAP is such a valuable program and it has improved impacts overall on the health and economic security of older adults, only about half of eligible older adults are participating in the program. Right now, about 52% of those who are eligible are not participating. Because of this, NCOA has conducted research to understand why older adults don't participate in the valuable program. We found that there are 5 common reasons why older adults don't participate. 1, they believe that other people need SNAP more than they do, and they think that they are taking away benefits from other people. They think that SNAP is only available to families who have children. They are not aware that any stores near them accept SNAP, so they don't know how to use the benefits if they receive them. And they believe they will only get $15 a month in benefits. And that is the current minimum benefit, but it's not the average benefit that an older adult would receive. They also think the application for SNAP is too hard to deal with. So NCOA has identified strategies that can be used to increase participation in the program. We recommend conducting outreach and educating seniors with information to empower them to make an informed decision about their SNAP eligibility. Many of the reasons I've mentioned that seniors don't participate in the program are actually due to misconceptions about the program. For example, not knowing where to use your SNAP benefits. If someone can provide you with the information about which stores in your neighborhood or in your community or which farmers markets accept these benefits, then people are more likely to enroll in the program because they know how to use them. We also encourage our community-based partners to provide comprehensive SNAP application assistance at their sites, because we found that when someone receives application assistance from a trained benefits coordinator, then that older adult is more likely to successfully enroll in the benefit. We've also identified ways that states can make the application process easier. And many of these are actually possible under current law, but states have to take the option or they have to get a waiver in order to use these flexibilities. So for example, states have the option to lengthen certification periods. So right now, most states have a 6 to 12 month certification period, but through waivers, they can take up to a 36-month certification period. And for older adults with no earned income, their household situation is not changing that frequently. So most likely what they've submitted in their original application as far as their income and their expenses is going to remain true throughout that longer certification period. And it does require that if things change for them, that they do submit updated information. There's also the option to waive the interview at recertification. Coming in for an interview or scheduling an interview can be very burdensome for older adults who might have transportation issues or mobility issues. And so not having to schedule that interview and figure out how to get there or how to have the interview can also reduce churn from the benefit. And finally, using electronic verification sources to verify information on the application, and that would be the states using those sources to verify the information, makes it easier because when you submit your application, you don't have to submit so many additional documents to verify everything you put in the application. It can be done electronically. Almost all the information that's needed can be found through the Social Security Data Exchange and other electronic sources that are already available to states. And so what we know right now is that these options are available, and throughout the pandemic, we've actually seen states increase their use of these optional flexibilities. And so we know that even after the pandemic ends, food insecurity among older adults isn't going anywhere. So we need to continue focusing on improving access to SNAP. The other aspect is that we need to continue focusing on improving the adequacy of the benefit amounts that are received. In over 99% of counties in the country, the current benefit amounts were not enough to meet the true cost of groceries in that county. And so we need to look at increasing the minimum benefit amount, and also look at the meal plan that's being used to calculate all benefit amounts. So right now, the Thrifty food plan is used to calculate benefit amounts, but based on that, the benefits are not adequate to meet the needs that people are experiencing. So even when the pandemic ends, the issues we're seeing around food insecurity and adequacy of SNAP is not going to go away.
Thank you, Erin.
Thank you.
Our final panelist is Radha Muthaya. Radha is the CEO of the Capital Area Food Bank, the leading food provider in the Greater Washington region. As CEO, she heads a team that sources and distributes good, healthy food directly and through a network of over 400 partners. In a typical year, the Capital Area Food Bank reaches more than 400,000 food insecure individuals in the region, but that number has risen to almost 600,000 since the beginning of the COVID-19 pandemic. Under her leadership, the Capital Area Food Bank has evolved its operating models to respond to this crisis and has developed long-term strategies to support equitable economic recovery with help of public, private, and nonprofit partnerships. Prior to her role at the food bank, Ms. Muthaya has led and grown both startup and established organizations spanning multiple sectors in the US and internationally. She serves on the board of Connected DMV, the Greater Washington Board of Trade, and the Public Health Institute. She holds a bachelor's and a master's degree in economics from Tufts University and a Master of Business Administration from Stanford University. Please welcome Radha Muthaya.
Thank you, Fabian, and thank you to all of the panelists who've spoken ahead of me. They've thrown out many different statistics and definitions, so I will not share that again with you. But just to during the course of the pandemic. What we've seen over the course of the pandemic is about a 50% increase in food insecurity across our region. And as has been mentioned before, when we've seen spikes like this in the past, they take a very long time to decrease and for the community to recover. So the most important thing that we're seeing now is, yes, our response and continued response, because it will take us quite some time to ensure an equitable recovery for those who've been impacted in particular by the pandemic. What we have seen is that of this increase, now we have 600,000 food insecure individuals across our region. We have seen that 85% of those who are food insecure identify as either Latino or Black African American. So you see the impact immediately on minorities within our area. We also see a significant impact on seniors. Even pre-pandemic, about 14% of seniors were food insecure in Washington, D.C. This is the highest of states and cities throughout the United States. So right here in the nation's capital, we have the highest level of food insecurity among seniors across the country. This has been a significant issue, and it's certainly been heightened during the pandemic. We have seen and heard from our partners about 40% of all of the individuals who they are providing food to now are first-time food insecure. So these are individuals, seniors and otherwise, who have been able to make ends meet, paycheck to paycheck, social security check to social security check, but have seen a need to be able to have seen the need for more support to be able to meet their needs during this very difficult time frame. The other thing that we're seeing here when it comes to seniors, it's really important to focus on the type of food that we're providing to our seniors. You've heard already the importance of good nutrition early and often in order to have positive health outcomes as we age. And that is an important factor that we take into account at the Capital Area Food Bank in terms of the type of food that we're providing to our seniors. So we focus on food that is fresh, so fresh produce, fruits and vegetables, as well as foods that are low in sugar, low in sodium, and high in fiber. This is something we've done even prior to the pandemic, and we've just been fastidious about it during the course of the pandemic. So number one is just the type of food that we need to continue to provide to ensure good nutrition and healthy outcomes at every stage of life, but in particular at our more advanced stages of life. Second, for seniors, we've been focused on really innovative channels of distribution. During the pandemic, of course, we had social distancing. Our seniors were afraid to go into any sort of congregate setting, even when those were allowed. And then we didn't have congregate settings. They've been concerned about using public transportation to be able to move around. So we had switched to an all delivery model, and being innovative in how we do that. Ride shares, the DC Taxi Cab Association, all partnered with us to be able to get fresh boxes of produce and shelf-stable items to our seniors. And so that's something that we need to continue to do even as we come out of the pandemic for our seniors. There was a discussion earlier and mention of food deserts, so areas where there aren't proximate access to full service grocery stores that offer a wide variety of products. The food bank has a program called Curbside Groceries that brings that whole market basket of food to you, to your neighborhood, often to senior centers or where we've got a density of seniors in different areas. And that's important because it's good, healthy food that is brought to a person's, street corner, doorstep, community center. And there we aren't making the assumption that seniors can make their way to a grocery store that may be a mile or two or more from where they live. The other important thing that was mentioned earlier also in how we work is we're very client-centered and data-driven. And being data-driven is critical because you need to understand what the lay of the land is in terms of your hunger heat map. So we've got a hunger heat map that targets and shows us down to the zip code and census tract level exactly where people who are food insecure are. And we're able to segment by age, by race, by income, by proximity to healthcare, proximity to transportation, so we can better determine the right channel of getting food to people. We don't want to make an assumption that people can take the bus or take the metro to get to where a food distribution might be if they don't actually have access to that. And so by layering all of this data onto our hunger heat map, we're able to determine the right type of channel to be able to get food, and we're able to target populations. So we focus a lot on culturally familiar food. We don't expect that everybody's dietary patterns are the same. And especially given that we have high proportions of Latinos and African Americans who are food insecure, we want to provide the appropriate culturally familiar food to them. So that's something else that we are focused on. When we speak about seniors, we also don't want to assume that that is one homogeneous group. Seniors can be in age from 60 to 90 plus. They have varying abilities, varying degrees of mobility. And so we want to offer a variety of different types of foods to them. So far, we've been offering a lot of groceries. We're also thinking about pre-cut groceries for those who might be struggling a little bit with arthritis and things like that. And we're also partnering with others, many other organizations, to provide prepared meals in some cases. So these are the types of things that we're thinking about and will continue to develop programming around, because we don't want to assume that our seniors are all the same with the same interests, abilities, food habits, mobility. And the last thing I'll say is that it's so important, especially when we're working with seniors, but overall with the food insecure population, is to be able to work with governments and to work with other nonprofit and private sector partners. Partnerships are critical for us. It allows us to be innovative in so many different ways by bringing the assets of different organizations together for the benefit of our clients. And you've heard mention of policy, and that's critical as well. There's only so much we can do outside of the government space, but there's so many excellent safety net programs that are underutilized, as has been discussed. But we also need to look at this issue of food insecurity not in a silo, but realize it lives in coexistence with issues of housing, issues of medical care, issues of transportation. And so the solutions, even from a policy front, have to be well integrated. And the solutions and safety net programs shouldn't just be siloed. Those need to be integrated as well. And I look forward to a conversation that we'll have around that and many other issues as well.
Thank you, Radha. At this point in the program, we're going to begin the Q&A session. So we've heard about the importance of nutrition for seniors to healthfully age, the inequities that exist with nutrition, the governmental challenges with getting people enrolled in SNAP, and the difficulty charity organizations have faced during the COVID-19 pandemic. As I mentioned earlier, 80% of older adults have at least one chronic health condition. How do we approach food insecurity when looking at specific diseases like heart disease or type 2 diabetes? And should assessing access to food be implemented as a vital sign used by practitioners? And anyone feel free to hop in and answer that.
I'm happy to start. For us, it's really critical as we look at the food that we're providing to make sure it's nutritionally balanced. And so we do that in a few different ways. We're constantly listening to our senior clients, and we're understanding not only what they need, but what they find expensive in stores, and therefore they would like us to be able to provide so that they're able to stretch their budgets a little bit further. So this balance, we provide about 35 to 40% of everything that we provide at the food bank is fresh. So it's fruits and vegetables. And then the remainder 60%, we focus on the low sugar, low sodium, high fiber products. I mentioned culturally familiar. We're trying to increase that percentage of culturally familiar items just because we know that everybody eats differently, and we're not here to change the way people eat. We just want to make it easier for them to eat in a nutritionally sound way.
Well, Fabian, I'll jump in and just say that I think screening is really great, but if the screening isn't followed up by connecting people to resources, then it's pretty much useless. So there's this tool called the Hunger Vital Sign, which is a 2-item tool that's been validated for clinical use among older adults. The AARP Foundation supports this tool, and it really can identify food insecurity among older adults. But the key in using, one of the great things about that tool is it's a 2-item, so it's easy for clinicians to administer. It's not cumbersome and time consuming. And so it's really helpful in the sense that when you're screening older adults for depression and isolation and other things, that you have this tool that's not cumbersome to use. But again, the key is connecting people to resources. It would be pretty much unethical to screen people and then say, okay, that's it. So if you're not going to be informed and have staff and resources to connect people to food, then you really should not screen.
I actually couldn't agree with you more. I think it's really important to close the circle. I know that in our healthcare system, we screen our veterans and obviously once identified, they are referred for services, whatever those services might be, whether we need to make sure that they are made aware of services within the community, whether they need to complete their application for a SNAP program, whether they need to meet with a dietitian one-on-one. We do healthy teaching kitchen classes with some of our patients just to make sure that we're reinforcing some of the things that are important to them. But we try to make these things realistic because teaching people to eat whole grains and all these healthy foods, it's great, but it's got to fit their budget. And if at home you only have a microwave and a toaster oven, we need to teach people how to use that toaster and microwave oven to do something that will really help them promote their health.
Yeah, that really segues into one of my next questions. So we know that access to food is just the beginning. How do we ensure seniors, especially those living at home alone, have the tools and skills necessary to cook the food once they get it into their homes? This is more than just a financial resources question, but a quality of life question.
One way that we're addressing that is by providing recipe cards for the food that we do provide to our clients. The other is we've got nutritionists on staff, and so we're able to develop simple videos that can be streamed and that we can share with individuals. Sometimes it's very hard to cook for one. We all hear that, whether you're a young professional or a senior, and the temptation is to be able to pick up something quickly, and often what's quick and cheap, is not necessarily healthy for you. And so the guidance from our nutritionists is something else that we offer to our seniors. The last thing I'll say on this topic is, what was mentioned before about the screening tool. So important, whether that's for veterans, for seniors, for children. We're working with a couple of hospitals and clinics in the area to establish food pharmacies. So once people have been screened, they're able to be sent, while they're in the hospital, to a food pharmacy that might be on another floor, and with that prescription, the doctor may have said needs to eat more greens, needs to eat more protein, and we're able to provide it to them before they leave the clinic or the hospital, with then a referral of a food pantry that's closer to where they live. So these are the types of things I think that can encourage healthy eating.
I also think it's really important for all of us and for our audience to know that for older adults who are also on Medicare and Medicaid, there's a benefit in Medicaid called homemaker services. And within that service, people have access to people that can come into the home and clean and do other things, but they're also allowed to prepare meals. So that's a way for seniors who don't have the ability to get to their kitchens or able to manage cooking to receive that service. And alternatively, Medicaid also accommodates family caregivers. So if you are a family caregiver and you are performing that service for a person that's receiving a home and community-based services, you could also get, in some cases, you can get reimbursed for that. So there are ways to use the Medicaid program to help people to get access to food preparation services.
And even during the pandemic, what we've done is we've taken on healthy teaching kitchen classes and provided them with VBC, which is a video connect. It's almost like a telehealth program, so that people from the comfort of their home, they're still getting their healthy teaching kitchen classes. And we've done some specialty classes just for folks with diabetes or for individuals with renal disease, so that way they can really get some guidance as to how to best process foods and take care of themselves. And like Linda said, we do allow caregivers to come into the healthy teaching classes with them, because very often they're the ones doing the cooking, not the patient in and of itself. So it's really important to really tap into their support system, so that way we have a better opportunity of being successful.
Great. Erin, anything from the NCOA?
We've seen with our partners many of the same things that you're saying. A really big focus has been on providing not just the access to the SNAP benefits, but how to use SNAP once you have the benefits. So how to grocery shop, for one, we get a lot of questions about that. things are only sold in these really large amounts, and I'm living by myself. And so we have actually a series called Next Steps to Better Nutrition on our website that provides a lot of information about how to prepare foods that are designed for a person who's eating alone, or how to stretch one meal or one recipe over multiple meals. And I think making sure people have the tools to maintain their independence, so to be able to eat what they want to eat and how they want to eat it and still be eating healthy and adapting to their unique circumstances is really important.
Great. So as we know, the Biden administration is planning on having every adult vaccinated by the summer. When the COVID crisis is behind us, what have we learned, and what do we go back to in the everyday fight against food insecurity?
You know, I think it's really important to meet people where they are. A lot of them might have gotten worse throughout this process. And if you link, and I'm sorry, but my focus is usually a little healthcare inclined, but you know, if you've had people that have had to delay regular care, what's considered just routine care, maybe they're not in the same spot where we left them before the pandemic. So the ability to recognize that quickly and put interventions in place to help our older adults, it's extremely important.
And I would just add to what Nancy said, you know, what struck me really hard is the fact that so many people came into the pandemic in compromised health, and that just attributed to them spiraling downward. So that means we need to double down on our efforts to make sure that people are as healthy as they can be, because we never know when the next emergency, in addition to just it's the right thing to do to make people and keep people healthy, we never know when something else is going to hit from a public health perspective. So we really need to redouble our efforts to ensure that particularly low-income people and people of color, we're helping them maximize their health outcomes through nutrition, but also through, you know, the health system that has a lot of work to do to get people maximized in their health status. The other thing that struck me about the COVID crisis was the impact on the food distribution chain, and how there were so many breakdowns in that chain, which drove food prices up. And, you know, older adults and people receiving SNAP really, they had these limited dollars, and they couldn't respond to the increase in prices. So I think it's something that we should give more. I had never thought about the distribution chain and the impact that it could have, the significant impact it could have on prices to make food even more unaffordable than it already is for millions of people. So those are my two big takeaways.
I would add that we're excited and thrilled that the Biden administration has accelerated the vaccine rollout. It was so supply constrained initially. It's exciting to see many different types of vaccines appearing. Something very immediate for us is to encourage those who we provide food to actually sign up for the vaccine. We're seeing lower rates of vaccination amongst those who are, are people of color. And so part of what we're trying to do is, in some cases, provide food as that incentive to be able to get people to the point of being vaccinated. I would also say that with all of this excitement, we shouldn't forget that those who were the most impacted, those who were the first impacted in many cases because of the pandemic, are likely to be some of the last to recover from this pandemic. So in our excitement and euphoria of being able to socialize and be out there with one another in the summer, we might all think that things have returned to somewhat normal, by the summer or fall. And it's important to remember that this is a very long road ahead for those who've been impacted, for those whose savings have been depleted, and for those who might not likely get back on their feet with living wage jobs for many, many months to come. So for us, we're looking at this as definitely a marathon, and not this, 52-week sprint, if you will. This is definitely going to be with us for some some time. And especially when we look at the Black and Latino population, we don't want to return to the pre-COVID normal. It wasn't equitable. Certainly in the greater Washington region, it was terribly inequitable even before the pandemic, and it's only gotten worse. So for us, we're going to continue to focus on response. We know we'll be probably putting out, millions more meals than we have, before. And we also, though, want to help with the recovery of our region. And that's where the advocacy is important. Our clients have been at the center. Food security and health issues have been at the center of the conversation for the last year. It needs to remain there for some time to come so that we help our clients be a part of the rebuilding and the economic growth that will occur. So that's going to be, yes, we'll be, providing more food, but we're going to be advocating in a big way to ensure that the recovery is an inclusive one, especially with savings being so depleted now. People have to start from scratch, and that means, greater integration of various policies and better safety net programs for some time to come, not just through executive orders that, end in September or end in December. It's got to be something that is enacted into law for a few years to come.
Great. We're now taking questions from our audience. So one of our questions is from Karima, and she's asking, how do we address the waste in the food supply chain? And I also want to kind of couple this with the extreme weather events that we saw in Texas with the freezing and the role climate change has had in making the COVID-19 crisis worse. So how do we prepare for climate change and its impact on food supply?
I'm happy to take that, given that we're very much at the center of the food supply chain here. A few things that, the questioner is right. There were lots of challenges in the agriculture supply chain over the course of the last year, in particular last spring and summer. One of the issues that Congress enacted, the Farmers to Families program, or the Coronavirus Food Assistance Program, was critical because it took excess yield from farmers and provided it through food banks to those who had a need. So we're going to have to think creatively in that manner as we go forward when we have spikes in food supply in one part of the country or one part of the world, and think about effective, seamless supply chains to be able to get those to those who need it. I don't think it's just the pandemic, as we've seen in Texas, as we've seen with just climate change, and the Earth's temperature rising, and how we have more frequent, hotter summers, colder winters, etc. It has an effect on our global food supply. And so resiliency and how we plan and prepare for that, where we source from, is all critical. So for us as a food bank, the only way we've been able to provide 62 million meals worth of food in the last year is by essentially looking across the globe in terms of where we source and how we source to ensure that continuity, but also supporting local farmers, and what they need to ensure that we can also source locally, when there are these challenges that occur in other parts of the country and globe.
Yeah, and another thing that I think is important is that we need to strengthen some of our programs that we have that are designed to deal with crisis. So for example, with SNAP, there is a disaster SNAP program that's designed to meet heightened need, but with the frequency that we've been seeing these types of crises and natural disasters increasing as a result of climate change, that program needs to be strengthened to meet the increased need that's being put on it. So I think there's a lot we can do to improve that program and make it work better and more immediately for people who are in crisis and need access to money to purchase food.
Great, thank you. We have another question from our audience from Yvette. Her question is, I have several older adults in my family that can benefit from SNAP, but I'm sure they have no idea this even exists. What is step one for them? How do we increase awareness in Black and Brown communities?
I would like to make a plug. We have an online tool called Benefits Checkup, and you can complete a screening on benefitscheckup.org that allows you to know what benefits you screen eligible for, including SNAP. And if you complete, there's a quick screening that's, I think, 5 simple questions. It only takes a couple minutes to do. There's also a more comprehensive screening that you can complete if you're interested in every benefit you're eligible for. The quick screening will just let you know about those key core benefits that help pay for SNAP, medical expenses, and energy. But if you complete the screening, it also connects you with resources in your area. So for example, our benefits enrollment centers that can help you complete an application, or your local food bank, if they are available, if there's one available in your zip code. So it's based on your zip code. If there's a food bank that serves your zip code, or if there is a benefits enrollment center that serves your zip code, all of that information will be available at the end of the screening. So I think that's one website that you can point someone to, or you can help them do the screening themselves to find out if they're eligible for the program.
Thanks, Erin. I would just add to that. So awareness is just one part of the equation. As Erin talked about in her talk, it's more than that. It's stigma. It's misperceptions about the program. It's being fearful of the application processes. So I would also encourage, in tandem with putting people at the benefits access website and et cetera, that we also do some focus group work with individuals who are eligible but not enrolled in the program, to learn more about what we can do to outreach and educate in ways that would help them overcome a lot of these barriers. So I think doing both hand in hand in tandem would be really helpful, and help inform us about what we need to do to really bring that 52% who are eligible but not enrolled in the program into the program.
As Erin mentioned, I think do reach out to your local food banks, depending on where you reside in the country. If you're in the greater Washington area, you can reach out to us, capitalareafoodbank.org, and we can connect you with those who are doing the enrollment. And as it was mentioned earlier, sometimes it's just the support to go through the form, and that is available in many instances as well.
Great. And as we wrap up here with our question and answer period, we have one more question from Daniel Rivera. He's asking, what are SNAP resources that are available in Spanish, and how do we help people who speak different languages?
In our area, there are definitely resources in the greater Washington area that are available in Spanish. I suspect there are in many parts of the country as well. There are many ways in which we can really seek to support Spanish speakers. One, we're able to provide a lot of materials in Spanish so that it is understood. I mentioned culturally familiar foods. I know we're doing a lot of that, and others are too. So that's important to have, to voice what your needs are, and not feel you just have to receive what is being given to you. I mentioned our curbside groceries program, where it's a food store that comes to you. It's not a mobile vehicle. We have one with, all kinds that's in Spanish, wrap of the truck, so that people understand what that is, and that will also carry culturally familiar food. So there are lots of different things that we can do, but the first step is for individuals to ask for it, and we're happy to respond.
And just so you know, ARP translates almost all of its food insecurity resources into Spanish. We do a lot of outreach in the Hispanic community, so that's another resource, is the AARP website.
Yes. And our resources, the benefits checkup tool, is available in English and Spanish. At the top of the page, you can toggle between languages, and if you complete the screening in Spanish, it will connect you. I think almost every state has the SNAP application available in Spanish, so the application itself will be available in Spanish. But I think states vary in in all the resources they have that you can access in Spanish. But I will say, if you are trying to complete your application for SNAP, or you're trying to complete your interview for the SNAP program, and you need specific language assistance, translation services, you can request that when you submit your SNAP application, so that you can get an interview in Spanish or whatever language that you need assistance with in.
Great. So I think that's all the time we have for questions. So I'd like to thank our audience for engaging in this discussion. For our panelists, before we leave, I'll give you a minute to wrap up your final thoughts and ask if you have our audience take one thing away from today's discussion, what would that be? And we can just go in order of how we spoke. So Dr. Munoz.
The one thing that I would love for people to remember is that food is medicine, and food is chemistry. And the old adage of we are what we eat, has never been a truer statement than it is right now, that it is important to ensure that we have not just food, but nutrient-dense food in the right amounts in efforts to promote health. Facilitating ability of healthy food impacts not just our physiological well-being, but it's a matter of quality of life. Everybody has an expiration date, but how well we live depends on how well we eat. So if we can just remember that, I'll be very happy.
Thank you so much. Linda?
Yes, I would like everybody to remember that food insecurity affects millions of Americans and was affecting them even before the COVID-19 crisis. And I think the COVID-19 issue has shed light and brought to the forefront many of the issues that people have been dealing with historically and over many, many years. So I think that once this pandemic is over and we're able to get out and about, we shouldn't forget about those people that are going hungry, that are going without insufficient nutrition and resources. Because in many cases, particularly among Black and Hispanic communities, those were the conditions that contributed to the inordinate and disproportionate impact of the COVID-19 on those communities. So it behooves us to keep focused and keep concentrating on working in those communities to improve their health status, even during the good times, because those are the individuals that suffer disproportionately when crisis hits our country. So that's what I would want.
Thank you so much, Ms. Flowers. Erin?
Yes, I would echo what Linda was saying. We didn't enter the pandemic without food insecurity. Millions of older adults have been food insecure, and they have not been able to access the supports that they need for a long time. And one of the positive things that I think was highlighted during the pandemic is that states do have flexibility that they can access to increase the access to SNAP and make it easier for older adults to apply for the program and increase the benefit, the adequacy of the benefit amounts. And I think continuing to support the use of those flexibilities that we have seen during the pandemic is important to make sure that older adults can access the program, they know how to use SNAP, they know where to use SNAP, and they can stay enrolled in the program so that they have the money they need to get the food they need to age well.
Thank you so much, Erin. And Radha?
I think just as others have said, the attention has been significant and warranted over the last 12 months, but we shouldn't forget, and we need to continue to focus on the issue of food insecurity and on the populations that are affected until they're able to sufficiently recover. And that could be a few years from now, as I mentioned, more of a marathon and less of a sprint. I think the other thing that's really important is that we all came together in very interesting partnerships over the last 1 year to support the neediest of our neighbors. Let's continue with that spirit of public, private, and government partnerships to be able to continue what we need to do. And the third thing is just policy. There's so much that the government can do that those of us in the nonprofit sector cannot. But it is important for us and for them to take an integrated approach. So the Domestic Policy Council that's been formed would be an ideal place to be able to bring together issues of housing, skill development, food, health, to be able to holistically address the needs of food insecure and especially senior food insecure residents.
Thank you so much. And thank you, everyone. Please have a virtual round of applause for our wonderful panel. As we look to the future, we know that we have our work cut out for us. You've heard from national experts on the challenges of food insecurity, the importance of nutrition for healthy aging, and how you can be part of a solution in your local community. Thank you to the Congressional Hispanic Caucus Institute for holding a space for us to have this conversation. For those of you on the East Coast, enjoy the rest of your afternoon. And for those on the West Coast, have a good rest of your day. Let our challenges motivate us to create a more just, equitable, and healthier world going forward.